Margaret was 80 years old. She still lived on her own. She drove herself to the grocery store every week. She enjoyed gardening. She cooked her own meals, and although she had chronic lower back pain, she was still living the life she wanted. Then one day, she met with a surgeon. He looked at her scans and confidently recommended spinal surgery. He explained the procedure. He explained the benefits. He explained how modern techniques had improved outcomes. Margaret trusted him. She believed this operation would give her a better life. The surgery itself went exactly as planned. From a technical point of view, it was considered a success. But the story did not end there. The recovery was far more difficult than anyone expected. Weeks in bed became months of weakness. Her muscles shrank. Her confidence disappeared. Simple tasks became exhausting. Instead of becoming more independent, she became dependent on others for almost everything. The operation had fixed her spine, but it had taken away the life she was trying to protect. I am Dr. Arthur Vance, and today I want to talk about something that deserves far more attention than it receives. Surgery saves lives. Every single day. There is no question about that. Some operations are absolutely necessary. Some truly are life-saving. But after 70, the conversation becomes much more complicated, because the goal is no longer simply surviving an operation. The goal is recovering well enough to continue living the life you value. As a son, I would never want my parents agreeing to a major operation simply because someone said it was routine. I would want them to understand not only what the surgery can fix, but also what it might cost in strength, memory, mobility, and independence. That is the conversation many families never have. Before we begin, tell me your age and where you are watching from in the comments. I always enjoy seeing how many people are joining our growing community. Now let me explain why surgery becomes different as we grow older. Every operation places stress on the body. The skin is opened, tissues are disturbed, inflammation increases, the immune system goes into repair mode. A younger body usually handles this remarkably well, but after 70, recovery often becomes slower. Muscle is lost more quickly during bed rest. Balance declines faster. The brain may become temporarily confused after anesthesia. Even a successful operation can leave an older adult weaker than before. That does not mean surgery should be avoided. It simply means the decision deserves much more careful thought. Now let's look at 7 operations that often deserve a second conversation before saying yes. The first is spinal fusion for chronic lower back pain. Back pain is incredibly common after 70. Years of wear and tear affect the joints, discs, and ligaments of the spine. When pain becomes persistent, surgery may sound like the obvious answer. But here is the question many people never ask. How likely is this operation to actually improve my daily life? For some people, the answer is yes, especially when severe nerve compression is present. But for many older adults with chronic back pain alone, recovery can be long and difficult. Hours in the operating room are often followed by weeks of limited movement, and limited movement has consequences. Muscles weaken, balance declines, confidence disappears. Many people discover that although one problem improved, several new ones appeared. That is why physical therapy, exercise, weight management, pain management, and other non-surgical treatments deserve every opportunity before major spinal surgery is considered. The second operation is knee arthroscopy for arthritis. This surprises many people. They assume cleaning out the knee must help. But arthritis is not simply loose pieces floating around inside the joint. It is a disease affecting the entire joint. For many older adults with arthritis, physical therapy often provides results equal to or better than surgery without exposing them to anesthesia or recovery complications. As a son, I would much rather see my parents strengthening the muscles around the knee before rushing into an operation that may not improve long-term function. Now, let's move to the third procedure: carotid artery surgery in someone who has never experienced stroke symptoms. The carotid arteries supply blood to the brain. If severe narrowing is causing warning signs such as temporary vision loss, weakness, or mini strokes, surgery may absolutely be appropriate. But finding narrowing on a scan alone does not always mean surgery is necessary. Many people live for years with narrowed arteries while remaining completely symptom-free. Good blood pressure control, healthy cholesterol levels, stopping smoking, managing diabetes. These often provide tremendous protection without exposing someone to the risks of an operation. That is why every recommendation deserves an honest discussion about risks and benefits. The fourth procedure is preventive gallbladder removal. Gallstones become increasingly common with age. In fact, many people discover they have gallstones completely by accident. The important question is this: are the stones causing symptoms? If the answer is no, surgery may not provide any benefit at all. Removing an organ that is not causing problems simply because stones exist may expose someone to unnecessary risks. Many older adults never develop symptoms from silent gallstones, and those people may never need surgery. Observation is sometimes the safest treatment. Now, before we continue, remember this: doing less is not the same as doing nothing. Sometimes careful monitoring is excellent medical care. Now let's discuss hip replacement. Hip replacement can be life-changing for someone with severe arthritis. When pain prevents walking, sleeping, or basic daily activities, replacing the joint may restore quality of life. But timing matters. Some people undergo surgery while they are still functioning reasonably well, and recovery becomes much harder than expected. Every week spent inactive leads to muscle loss, and after 70, rebuilding that strength becomes more difficult. That is why conservative treatments should always be explored before major joint replacement whenever possible. Weight management, targeted exercise, physical therapy, walking aids, pain management. Sometimes these approaches delay surgery for years while preserving independence. The sixth operation is coronary artery bypass surgery for stable heart disease. Now let me be clear, if someone is having a major heart attack, emergency surgery can absolutely save a life. That is not what I am talking about today. I am talking about someone whose symptoms are stable, someone who has chest discomfort during activity but is otherwise doing well with medication. In many cases, aggressive medical treatment combined with healthy lifestyle changes can provide excellent results without exposing an older adult to the enormous stress of open-heart surgery. The decision should never be rushed. It should involve thoughtful discussion with both the cardiologist and the surgeon. Now we come to perhaps the most important point of today's conversation. The seventh category is not one specific operation. It is any major elective surgery in someone who is physically frail. Frailty is different from age. Two people may both be 80 years old. One still gardens, shops, cooks, and walks every day. The other struggles to climb stairs, has lost significant weight, feels exhausted most of the time, and walks very slowly. Their birth certificates show the same age. Their bodies do not. Frailty dramatically changes recovery. Someone who is already weak has much less reserve when facing surgery. That is why frailty often predicts outcomes better than age itself. If someone is frail, every operation deserves even more careful consideration. Now here are 5 questions I encourage every older adult to ask before agreeing to surgery. The first is simple. What are my chances of being genuinely better 1 year after this operation? Not just surviving, actually functioning better. The second question is equally important. What are the most common complications for someone my age? Not the average patient, someone like me. The third question. What happens if I decide not to have this operation right now? Sometimes waiting is perfectly reasonable, sometimes it is not, but you deserve to know. The fourth question, have we truly tried every reasonable non-surgical option? Exercise, medication, physical therapy, lifestyle changes, pain management. Sometimes these approaches provide remarkable improvement. And finally, ask the question I believe every surgeon should answer honestly. If I were your parent, would you recommend this operation? Watch carefully how they respond. Sometimes their answer tells you far more than statistics ever could. Now I want to leave you with one final thought. After 70, healthcare is no longer only about living longer. It is about living better, protecting your independence, protecting your mobility, protecting your memory, protecting your ability to spend meaningful time with your grandchildren. Those things matter. Sometimes surgery protects them, sometimes surgery threatens them. That is why every decision deserves thoughtful discussion. Never feel pressured, never feel rushed, never believe you must say yes during the first appointment. Ask questions, seek another opinion if needed. Take time to understand the decision. Because the right operation, performed for the right reason, can transform a life. But the wrong operation, performed at the wrong time, can permanently change it in ways nobody intended. I am Dr. Arthur Vance, and your health is the only metric that matters. I will see you in the next consultation.